So for exercises with special populations, we're going to have to adapt to certain exercises. So for a client with high blood pressure, obviously we'd need to get a medical clearance before they performed any exercise. Due to the condition, all the exercises should be in a lower intensity, so you wouldn't get them to do a high intensity vigorous exercise. If we're to, for resistance training, rather than doing, say, a dumbbell bench press, we'd substitute that for something with a little bit less intensity, such as a wall push-up. Through all the exercises, you'd have to closely monitor the client, watching out for signs of any distress, so pale skin, for example. For a client with lower pain, again we'd need medical clearance, and we'd need to follow the advice of the health professional. As lower back pain could be spinal or a muscular pain, each would be needed to be adapted to be different. We want to minimise the flexion and extension of the spine. To work the abdominals during that time, a good exercise to throw in would be a supine hold, which is where you're on your back, tensing your abdominal muscles, but it minimises the flexion of the spine. Again, with a client with a knee injury, it could be structural or muscular, we'd need to get medical clearance and follow advice from a health professional such as an exercise physiologist. We try to avoid exercises that place a direct strain on that joint. As the recovery goes, we can start to introduce a bit of strength training there. An example would be to use step-ups, slowly increasing the height of the steps.